well, thanks very much, Lee. Thanks for coming in. Lee is the chairman of our Public Policy Committee and a member of the Healthcare Supply Chain Association. Lee, talk a little bit about the Greater New York and how it brings value to hospitals, long-term care facilities, and so forth.
Greater New York Hospital Association represents hospitals in New York, but we have a significant business presence around the country representing providers, not just hospital providers, but providers across all the levels of care in healthcare around the country. We have customers in all 50 states. We have 15,000 customers across the continuum of care. We started out as a small organization years ago, and now we're one of the biggest trade associations doing business in the United States.
So, Lee, you're chairman of our Public Policy Committee, and you're here in Washington today. Lots of talk about the fiscal cliff, deficits, both in Congress and the White House. Tell me how GPOs save hospitals and Medicare money.
Well, I kind of look at the GPO issue as a relatively simple issue. Hospitals and healthcare facilities spend money on two things: stuff and taking care of patients. And our job at the GPOs of the country, myself and my competitors, is to help our providers spend less money on stuff so they have more money for patient care. And no matter what happens in Washington, there is a relevance to spending less money on stuff. And we are really very important because GPOs represent the confluence of business and science and healthcare. We are the organizations that really empower our customers to be able to really work and get the lowest prices.
Right.
And it's not just about doing contracts. One of the things that's happened, Curtis, over the years is people think of us as just doing contracts. And GPOs are so much more than contracts. We are providing technical expertise to providers around the country, because if we did not exist, we'd have to be reinvented. Our hospitals, our nursing homes, they do not have technical expertise in things like radiology or laboratory or pharmacy. We're really an extension of them. And we allow them to go into the marketplace and be more effective purchasers.
Right. There was a recent report that suggested that hospital CEOs were going to use GPOs even more. To your point, I'm wondering if you're seeing that on the ground.
I think what's happened is the relevance of what we're doing is very important. You know, in the other days of old, there wasn't this type of cost pressure. And when there's cost pressure, again, people are deciding what is the way to save money in an institution when you have less resources. And again, people would rather spend less money on stuff and focus on patient care. And we're in that business of influencing the price of stuff.
Right.
And CEOs are now seeing what we're doing as much more relevant. And the other thing is that CEOs, I think we work for some of the smartest people in the country. I think executives of hospitals have voted unanimously over the years, whether it's myself or my competitors, that GPOs are a critical part of their toolbox in effectively managing their institutions. The other thing that's happened that is really a new innovation is, you know, GPOs have existed for hospitals for more than 100 years, but for nursing homes, assisted living, all of our friends and customers across the continuum of care, GPOs are new to them. They never realized there were organizations like the ones we represent that allow them to go into the marketplace and spend less time doing transactions themselves. We do not need nursing home executives. We do not need assisted living executives doing their own contracting for food. And one of the things that I think is very special is that we're able to bring cost economies to the biggest urban institutions, the smallest rural institutions, big city, small city, big institution, small institution. They all work together by working through GPO.
Right, right. You probably saw the Government Accountability had a report probably about 12 months ago about pricing transparency and the lack of pricing transparency, frankly, in the area of medical devices. Could you talk a little bit about confidentiality clauses and what gag clauses mean to hospitals?
Well, I think the thing that's so interesting to me is that healthcare is the only business when it comes to products that there isn't a normal business cycle. If we look at any other business in the world, let's talk about flat screen TVs. You know, 5 years ago, if there was a flat screen TV, only fancy people had flat screen TVs. Now, everybody has a flat screen TV. No matter what job you have a flat screen TV. Why? Because there was information and transparency. Everybody knows how many pixels there are. And competition comes into the marketplace because you have information. Information is what drives natural business processes. In healthcare, we do not have that transparency. And especially in the medical device area. One thing that's very important is sometimes we're defined as just doing medical device purchasing. And so much that's what's done by HSCA members has nothing to do with medical devices. We do an amazing job in capital equipment, food, pharmacy, regular medical devices, regular medical supplies. That medical devices are a very small part of what we do and should be a much bigger part. The reason we don't do more is because we do not have the toolkits to be as effective as we should be. Why? Because there is not transparency of information. It is strange that I go to you and say, Dr. Rooney, you are the best orthopedic surgeon in Washington, D.C., and because you are, we're going to give you a special price, but you can't tell anybody else what that price is. You can't, because it's special for you, because we love you more. And then I go down the street, the same medical device company, and say the same thing to somebody else and tell them I love you more. And what we have is a market based on psychology rather than business process, because you're a good guy. The doctor is not the bad guy. You really think you are doing the right thing for your institution. But what we now have is we have the most expensive sector of the healthcare supply industry, which is medical devices, where we don't have natural business processes. Why? Because I don't know what your price is. He doesn't know what your price is. You don't know what his price is. And you cannot do comparison shopping in any effective way. And I think these confidentiality agreements that we call gag clauses are really limiting the ability of people to make prudent purchasing decisions. I believe you as a doctor would have a different opinion about your allegiance to a company if you had more information about the pricing surrounding you.
Right.
And that's what we're saying. We don't believe that any of these medical device companies are bad guys. We celebrate innovation. We celebrate all the good they have brought to patient care in this country. We just want them to say, this is what their device is. This is what the market is for their device. This is what their device does. And we want them to be more open about the pricing. And we don't want anyone to be limited to be able to discuss the pricing, especially not even to be able to discuss it with their GPOs, who they have selected as their agent. As a hospital CEO, you should have the right to appoint your GPO as your agent in purchasing, and you should not have a technical document drawn up that basically says, we don't want the GPO to have the advantage of that information.
So you're just talking about basic competition.
It's basic competition. It's competition 101. And we have a sacred oath that we take as people representing healthcare facilities, which is, we're not only representing these facilities, we're representing those patients, we're representing the Medicare and Medicaid programs, which we are the proxy for. We have a sacred oath to create that level of competition. And this is not about that we have criticisms of the device industry. It's not that at all. What it is we believe that innovation will be rewarded. Great companies that have great products will have great profitability and great results.
So as you know, healthcare reform is an issue that everybody's talking about. The Supreme Court is about to zero in on this question. But talk about healthcare reform in general, regardless of what the Supreme Court.
I think one of the things that's coming out of healthcare reform, irrespective of what the decision is that there is going to be more responsibility for episodes of care across the care continuum. So I don't believe that hospitals will be operating in this vacuum, that the only care they're responsible for is what takes place in this physical hospital setting. They will have some ultimate responsibility, depending on what models happen, about care over a continuum. And I think what we've done, myself and my competitors in HSCA, is we've not only thought about purchasing in the hospital setting, but about other settings as well. And I think if we're going to take responsibility of the care of a patient, we need to take responsibility, not just what happens in a hospital, what happens in a nursing home, what happens in assisted living, what happens if they have home care, and what are those products that are needed at all those different stages of the care continuum, and how can we effectively work with an institution that may be taking responsibility for that patient across a care continuum.
Excellent. Leah, thanks for your time. I appreciate it very much.